Did you know that a person who's getting affected with stroke is losing 1.9 million neurons every single minute? And what if I told you we can reach inside your brain and pull out the clot manually without even a single cut? Hello, I'm Dr. Arjun Lokesh, Neuro and Vascular Interventionist, Chennai. We will start with the basics. What exactly is a stroke? So think of your brain as a city and blood vessels as the roads that carry oxygen and nutrients to every part of it. Now imagine one of these roads gets completely blocked. Brain cells in that area start dying fast. Here is what's really alarming. Every minute a stroke goes untreated, you lose about 1.9 million brain cells. That's why the golden rule in stroke care is time is brain, every second counts. So what are the warning signs and when should we act in case of stroke? There's one acronym we must all remember, that is B FAST. B stands for loss of balance or loss of coordination. E stands for eyes, that is when there is a sudden blurring of vision or double vision. F stands for face. When there is a sudden drooping of one side of the face, you ask the patient to smile, it seems uneven. Arms. A stands for arms. Ask them to raise both arms, one of the arms might fall down. And S stands for speech, can be slurred speech or strange speech or no speech at all. And T stands for time to call emergency. Do not wait. Do not say let's say how it goes. Act very fast. Now let's say you reach the hospital at the right time, and what does the treatment has to offer you? So most people have heard of clot bursting medicines, something called TPA or thrombolytics. You give an injection, it dissolves a clot. But this only works within a small window, about 4.5 hours, and not for everyone. So what if we could actually go in and physically remove the clot? It is the game changer in stroke treatment. We make a tiny puncture, usually in the groin or the wrist, no big incisions, no open surgery. We then guide a very thin flexible tube called a catheter all the way up through your arteries, right into the brain's blood vessels. Using live X-ray image, we navigate to the exact location of the clot. Then we use a device called a stent retriever. Think of it as a tiny mesh cage that grabs onto the clot and pulls it out. Or sometimes we use a suction like a very precise vacuum to remove the clot entirely. The whole procedure can take as little as 30 to 90 minutes. Patients who couldn't move their arm are raising it within few hours later. And the best part, the window for intervention can now go up to 24 hours in selected patients, a huge advancement compared to what it was just 10 years ago. So if you or someone in your family has any of the signs of B FAST, as I had explained earlier, just act fast and rush to the nearest comprehensive stroke center.